People often ask me about why I'm doing mindfulness research in visual snow syndrome, so it may be helpful for you to get a bit of a background context to all this. You may have heard about the work I've been doing using mindfulness-based approaches to treat visual snow syndrome. I'll share about why I'm doing this, the kind of work that we have done and what we are doing, and what is likely coming as we look towards the future. I feel very passionate about helping people with visual snow syndrome. I feel very much it's part of my duty as a professional in this area. I'm a neurologist and also a neuro-ophthalmologist, a medical doctor in London, United Kingdom. It's taken many years to be trained to where I am today, and I do feel very privileged to be able to have a lot of knowledge. And also I feel very privileged to have had very good training in research and delivered a lot of research, specifically in the fields of neurology, neuro-ophthalmology, neuroscience, and also much more coming out through with integrative and lifestyle approaches. As part of good practice as a medical doctor, I think it's important for us to always examine the evidence of what we're doing, and also important to keep an open mind. So with this approach, I am delivering research so that we can collect data, we can reflect back on what we think, whether it's true or not, whether it's supported by the evidence or not, and how that guides us towards improving care and delivering treatments for visual snow syndrome. After being qualified as a neurologist, I had the opportunity to do further subspecialist training in neuro-ophthalmology. I was very grateful. I trained with Dr. Gordon Plant predominantly, and also a lot of very high-level neuro-ophthalmologists in London. And during my training, I remember very well the first time I met somebody with visual snow syndrome, although it wasn't called that at that time. I remember Dr. Plant explaining to the patient about how it's to do with the filtering out of normal visual experiences that is disrupted. Fast forward to 2019, I was running a very busy medical practice. I was working in the National Health Service and seeing a large number of people in neuro-ophthalmology. So people in neurology and neuro-ophthalmology with various conditions related to vision and the brain. It was around that time when we started to understand a bit better about this condition called visual snow syndrome. The name was started to be coined as a syndrome. There has been a few papers coming out, and there were really good work by my other colleagues about the underlying processes of visual snow syndrome. It was becoming apparent that it was to do with a brain network issue. It's not a problem with the eyeball or the health of the brain. There's no structural problem, but it's the processing itself that's been affected. Some people use the description like a little software glitch, and for some people that can be a helpful concept because it's to do with the processing and not actually something actually physically wrong with the brain itself. Also, I was starting to bring in lifestyle-based interventions into my medical practice as part of the toolkit of what I offer people, including with sometimes medication, sometimes referring for surgery. Lifestyle-based interventions to improve their health is also part of the work I do to support their care. I got trained in mindfulness. Although I was a yoga teacher at that stage, I felt that I needed to get some more official certification to be able to talk about mindfulness. So I got trained as a mindfulness facilitator or teacher, and that's when I got very inspired and moved when I watched a documentary featuring Jon Kabat-Zinn, who first brought mindfulness into the medical community about in the 1980s, so a long time ago. I was so moved by it, and it made me decide at that point that I have a duty to bring this kind of research into the field so that we can show evidence or not whether mindfulness approaches could help people with visual snow syndrome. I wanted to do this because I knew that mindfulness from other high-level research by neuroscientists years and decades before about how mindfulness can change brain networks. And we know that visual snow syndrome is a brain network condition. So with one being a brain network condition, with mindfulness being shown in other research to be able to change the brain, I thought there is a hypothesis here to test. Can mindfulness intervention be used to change things for visual snow syndrome? And that's how I came up with the idea to do this piece of research, and we started it in 2019. I must say, when I first shared this idea, it was faced with a fair amount of skepticism healthy skepticism as appropriate. I managed to get a very small amount of funding. It allowed me to pay for my colleague, Dr. Janet Wingrove, that at that time I first met her, and she's now a good colleague and friend. So back then, I started working with Dr. Janet Wingrove, and the funding I was able to raise paid for her delivery of the sessions. We delivered it together, and that was how we started working together. And I managed to cover coffee and tea for my participants. Everything else I had to do. It was a group learning program, and we finished the first group in February 2020. Really amazing, the experience with the group. And the plan was to do another 2 groups. And that was the idea, that we first deliver it using questionnaire-based outcome. And of course, you know what happened? After that, we had the COVID-19 pandemic, which meant that people could not meet in groups. That was a group learning program. And also in the National Health Service in the United Kingdom, research were paused to be able to focus on frontline COVID work. There I was thinking, oh, that's it. Nothing else for us to do. We can't progress with the visual snow research. But there was a silver lining. The silver lining was that it gave me the rationale to do an interim analysis, because at that time it was thought that that would be the end of the study. And just with that first group, it showed a positive response, which was amazing. It was just a small group. I managed to present it at a prestigious meeting, the American Neurological Association meeting. And because of the COVID pandemic, it was the first time that such meetings were available online. I submitted it, presented it at this online platform, and then I started to search for funding for a functional MRI. I wanted to have functional MRI at the very start of the study design, but I couldn't raise the funds for it. Functional MRI is a type of research MRI that looks at brain connections, because you may remember I said that visual snow syndrome is a brain network problem, and functional MRI shows changes in that. And what I wanted to do was to show what happened using functional MRI before and after the mindfulness group intervention. And thankfully, I managed to be supported by Visual Snow Initiative for that. Before Visual Snow Initiative supported the funding for the functional MRI, I'm super grateful to the I Hope charity at Guy's and St. Thomas's, and also the Guy's and St. Thomas's charity, the GSTT charity. They gave me the funding to be able to pay for Dr. Janet Wingrove's delivery of the course with me. And then for the functional MRI, Visual Snow Initiative supported this. So what were the final results? We completed this in 2022, delays because of the COVID pandemic. We recruited a total of 21 people, and I mentioned that these were delivered in groups. So it was a total of 3 groups that was delivered, and there were 21 in total, split into these 3 groups. So the last 2 groups had the functional MRI test done, and incredible results. The total scores for everyone showed an improvement, which was amazing. From medical statistical analysis, there was what we call a statistical significance. So there was a significance already from their questionnaire. And what was even more exciting, or as exciting I should say, is that the functional MRI showed a change. This is incredible, because this is the first time that we show this can change the brain networks. The visual network issue in visual snow syndrome is almost like an extra heightening unnecessarily for vision pathways, and this showed a settling, which was incredible. This study demonstrated 2 things. Number 1, what we call feasibility. That means it's possible to deliver mindfulness as a group intervention in the context of visual snow syndrome, and it was acceptable to the participants. So that is what we call the feasibility aspect. The second thing that was super exciting is that with the functional MRI, it suggested this was also changing brain pathways, creating neuroplasticity or changes in the brain network. That was amazing. So that has led on to what we're doing now at the time of this recording, which is a randomized controlled trial. A randomized controlled trial is the gold standard. It is where we randomly allocate people to get the treatment in a group or people who are in a control group. So control right now is standard of care, which sadly is nothing. So people are coming into our program, they are randomized, so randomly allocated 50-50 chance of either starting together straight away as a group to do the mindfulness course, or a group that wait. And we do offer those people waiting after they've finished the waiting control head-to-head comparison. We do offer them the course as well. The primary outcome, meaning the outcome of interest, is the rating of people's visual snow syndrome for those who have done the program and those who are on waitlist control. And that is a total of 5 months after the time point when they first entered the program, or 5 months of waiting. So at the time of this recording, we are in the final phases of delivering this. At this stage, I can't tell you in detail what the results are for the randomized control trial because I need to do the data analysis and I need to submit it for peer review publications. So that would mean that my other scientific colleagues, my peers, will evaluate my work and give the critique about the quality of it and the analysis of what we are saying the results mean. I'll let you know as results come up. And of course, oftentimes Visual Snow Initiative asks me to do videos for them, so you may hear it through them as well. Another question people ask is that what is the mindfulness intervention? The mindfulness intervention we used was something based off this program called Mindfulness-Based Cognitive Therapy. MBCT, or Mindfulness-Based Cognitive Therapy, was a well-established program at that stage when I used it. It was originally designed for preventing recurrent depression, and it has been researched in multiple clinical trials for depression. When I wanted to test out the principle of whether mindfulness intervention can help with visual snow syndrome, I chose MBCT really for two reasons. One is that it was already a well-researched program, and secondly, there was already a well-established structure to it. And of course, I was trained to deliver it as well, so I know the nuances about the delivery and the methods of it. But because my MBCT is designed for recurrent depression, I made modifications to it. The key modification was that there were sections within MBCT that talked about how to prevent recurrent depression, and we removed that because obviously visual snow syndrome is not the same as depression. I also added in the concepts about why we're doing this research trial. And there was in the first study informal discussions about lifestyle-based interventions to help build brain resilience, which we then formalized it in the randomized control trial, the second study that we're doing, although mindfulness was still the main aspect of the course. So I hope this is helpful with understanding why I'm here, what we did, and where we're heading towards. Please feel free to put in a comment any questions, anything else you want me to cover. I'll see you in the next video.